The LEAP Programme Handbook. Government of Ghana, Ministry of Gender, Children and Social Protection. LEAP Programme. Version 3.0. Abbreviations: CDOs, Community Development Officers; CFP, Community Focal Person; CLIC, Community LEAP Implementation Committee; DLIC, District LEAP Implementation Committee; DSW, District Social Welfare; IEC, Information, Education and Communication; LEAP, LEAP, Livelihood Empowerment Against Poverty; LMS, LEAP Management Secretariat; MIS, Management Information System; MOGCSP, Ministry of Gender, Children and Social Protection; NHIA, National Health Insurance Authority; NHIS, National Health Insurance Scheme; OVC, Orphans and Vulnerable Children; PFIs, Participating Financial Institutions. Table of Contents. What is LEAP? Page 1. Who qualifies to receive LEAP? Page 1. Who are disadvantaged members? Page 2. How are beneficiaries selected? Page 3. Who receives the money? Page 5. Payments. Page 6. How are LEAP beneficiary households paid? Page 7. Never do the following. Page 8. What you should do with the money. Page 9. Eat well. Page 10. Educate your children. Page 11. Some other uses of the cash. Page 12. Stay clean. Page 13. Other available services. Page 14. Institutional arrangements for LEAP program implementation. Page 15. LEAP case management processes and procedures. Page 21. Beneficiary Charter of Rights and Responsibilities. Page 25. Enhancing linkages for LEAP beneficiary household members. Page 26. Safeguards. Page 27. How is the performance of the LEAP program assessed? Page 27. LEAP communication. Page 28. LEAP Management Information System, MIS, page 29. What is LEAP? LEAP is a cash transfer program for the poorest households in Ghana. Why does the government provide this program? 1. To assist the poorest households with basic needs, including food. 2. To improve the health and educational status of children in the poorest household. 3. To help the poorest households come out of their poverty situation. Who qualifies to receive LEAP? The poorest households in the community which have 1. Orphans and vulnerable children. 2. The aged or elderly who are 65 years and above. 3. Persons with severe disabilities who cannot work. 4. Very poor pregnant women and lactating mothers with infants under 1 year. Who are disadvantaged members? 1. Orphans and vulnerable children, OVC. They include single or double orphans, or children with disabilities, or chronically ill children. These are children with prolonged chronic diseases, or children in a household with a head who is a child under 18 years old, or children in a household with a head who is chronically ill, or children in a household with a parent whose whereabouts are unknown. 2. The aged who are 65 years and above and without support. 3. Persons with severe disabilities without productive capacity. 4. Extremely poor pregnant women and lactating mothers with infants under 1 year. How are beneficiaries selected? The process of selecting eligible households for the LEAP program is called targeting. Targeting involves some processes. A. Government's declaration of intention to expand nationally, i.e., a household is not selected based on daily or walk-in self-reporting of need. B. Public information campaigns are conducted in communities to create awareness. C. Households undergo proxy means testing (PMT) through electronic enumeration. D. Transmission of data from enumeration point to a LEAP MIS server. E. LEAP MIS compute, score, and rank against program eligibility extreme poverty threshold. F. Qualified households selected. G. Names of qualified households are published in communities and the opportunity provided for verification of the qualified households. H. Qualified households are enrolled onto the LEAP program. I. Enrolled households are registered onto the platform of a payment service provider. How are beneficiaries selected? Important note on selections. 1. The selected households are the poorest with at least one of the disadvantaged members at the time of selection. 2. Some households may become poor after the selection exercise, or other poor households may move into the community, but only those that live in the community when the officers came to collect the information are considered. 3. Other eligible households will be selected later. Who receives the money? If you qualify, you get a payment card provided by the payment service provider. Present this card when collecting your money. Who receives the money? 1. The caregiver of the household receives the money on behalf of all the members of the family. 2. If the caregiver cannot collect the money, you should inform the CLIC or CFP of another person in the household who can collect the money for the household. That is, a deputy caregiver. 3. The cash is supposed to be for the benefit of the whole household, with a special focus on pregnant women, infants, and other disadvantaged members. Payment. Money is supposed to be delivered every 2 months. That is 6 times a year. These are January, March, May, July, September, and November. LEAP grant amount. Households benefiting from the LEAP program do not receive the same amount. The amount a household receives is based on the number of eligible household members. A. One eligible member household will receive 64 Ghana cedis. B. Two eligible member household will receive 76 Ghana cedis. C. Three eligible member household will receive 88 Ghana cedis. And 4 and more eligible member household will receive 106 Ghana cedis. Remember, at enrollment, ask how many eligible beneficiaries are in your family. That is what determines how much you receive every month. These amounts are subject to review. How are LEAP beneficiary households paid? All the beneficiaries of the LEAP program are paid electronically on the eSwitch platform provided by a payment service provider through PFIs. The PFIs are basically commercial and rural banks. B. The eSwitch payment platform receives biometric fingerprint verification of beneficiaries before they can cash out their money. Thus, LEAP program operates on the principle that without biometric verification, there will be no grant, cash out, or payment to beneficiary households. C. The electronic payment mechanism eliminates fiduciary risk. Never do the following. Never give money to the following. 1. A CLIC member or CFP. 2. An assembly member or any other community member. 3. DSWO or CDO or RSWO. 4. Staff of PFI or bank official. 5. Official of LMS or MOGCSP. 6. Any other person or institution. He or she is either paid for the service delivered or volunteered to assist. What you should do with the money. Eat well. Babies and toddlers or children and adults. Exclusive breastfeeding until 6 months. Introduce soft foods after 6 months. The foods must be varied and nutritious. Maintain breastfeeding until at least 2 years. All members of the household should eat a balanced diet. Feed your children and household with a variety of nutritious meals. Otherwise, your child will fall sick often, will not grow well, and will not be able to learn in school. Feed all members of the household, particularly young babies and toddlers, pregnant and lactating mothers, the aged or elderly, persons living with disabilities, with a balanced diet, including fruits, legumes, and vegetables. Educate your children. Any person under the age of 18 is a child. Children are to be in school and not engage in work at the expense of schooling, especially those meant for adults. Children above 5 years must go to school and stay in school. No child should engage in the worst forms of child labor, which is any work that causes harm to a child in all aspects of his or her life. For example, no child should be engaged in fishing, cracking stones to sell, selling on the streets, farming, galamsey, or hunting. Some other uses of the cash. Medical care, school supplies, investments into farming or small animals and livestock, petty trading. Stay clean. To prevent diarrhea, cholera, and other harmful illnesses, wash your hands before or after doing the following. 1. Before cooking. 2. Before eating. 3. Before feeding your baby. 4. after visiting the toilet. 5. After cleaning your baby. Members of your household should not ease themselves in the open. Always use latrines or toilets. Other available services. All members of the family are entitled to a free NHIS card and free renewal on yearly basis. Pregnant women should have antenatal care and deliver in a health center for free. All children under 12 months should have free birth registration. Take babies and children to child welfare clinics for growth monitoring every 2 months until 5 years for free. Participate in project-based opportunities available in your community. Children above 5 years must go to school and stay in school. Remember, NHIS is free for all LEAP household members. Go and register or renew your NHIS card at the nearest health insurance office. Birth registration is free for children under 12 months. Antenatal and postnatal care is free with an NHIS card. Growth monitoring for babies and children is free. Institutional arrangement for LEAP program implementation. A. Ministry of Gender, Children and Social Protection, MOGCSP. Responsibilities. 1. Provide policy direction on the LEAP program. 2. Provide funds and technical support for the program. 3. Disburse LEAP beneficiary grants to payment service providers. B. Ghana National Household Registry, GNHR. Responsibilities. The GNHR was set up as a tool to assist social protection programs to identify, prioritize, and select households living in vulnerable conditions to ensure that different social protection programs effectively reach their target populations. 2. Provide data on very poor households to be enrolled by the LEAP program. 3. Support the reassessment of the poverty status of households either by providing existing data or collecting data required by the LEAP program where such data is not readily available. C. LEAP Management Secretariat, LMS. Responsibilities. 1. Develop program activities, annual work plans, and budgets. 2. Coordination of program implementation. 3. Development of manuals, guidelines, and other relevant materials for the program. 4. Undertake data entry for case management and their respective solutions. 5. Undertake monitoring and evaluation, that is regional, district, and community levels. 6. Provide timely and consistent information to all stakeholders. 7. Regularly update the MOGCSP of all critical matters affecting the program. 8. Manage relationships with development partners and other stakeholders. 9. Liaise with the DSWO or CDOs on the implementation of the LEAP program at the district and community levels. D. Regional Social Welfare Departments, RSWDs. Responsibilities. 1. Monitor the disbursements of LEAP bi-monthly cash grant to beneficiary households by PFIs. 2. Support the linkage of beneficiaries to other social services. 3. Report to the regional coordinating councils on matters relating to the LEAP program. E. Metropolitan, Municipal, District Assemblies, MMDAs. Responsibilities. 1. Monitor and supervise LEAP activities undertaken by DSW and CDOs. 2. Support DSW and CDOs with logistics to implement LEAP activities. 3. Support linkage of beneficiaries to other social services. District Social Welfare and Community Development Officers, DSW and CDOs. Responsibilities. 1. Provide update to LMS on LEAP's implementation at the district and community levels. 2. oversee LEAP's operations in the district. 3. Lead the formation and training of the DLIC in the district. 4. Lead the linkage of beneficiaries to social services at the district level. 5. Coordinate sensitization programs for CFPs, CLIC members, and LEAP beneficiaries. 6. Report on all LEAP activities to the District Assembly. 7. Facilitate the mobilization of LEAP caregivers or beneficiaries for payment. 8. Resolve cases that are considered low-lying fruits, that is, simple and minor cases, while referring high-hanging fruits, that is, complicated and major cases, to LMS for resolution. G. District LEAP Implementation Committee, DLIC. Responsibilities. 1. Coordinate the selection of CFPs or CLIC members in beneficiary communities. 2. Support the linkage of beneficiary households to social services at the district level. 3. Organize and conduct sensitization programs for CFP or CLIC members. 4. Report on LEAP activities at the community level to the District Assembly. H. Community Focal Persons, CFPs, or Community LEAP Implementation Committee, CLIC. Responsibilities. 1. Share LEAP information, education, and communication materials with households and support and organize them for enrollment. 2. Act as a liaison between the community and households, mobile targeting units MTUs, and DSWOs or CDOs. 3. Notify beneficiaries of payment dates, times, and venue. 4. Conduct home visits to monitor co-responsibilities, track, and refer cases. I. Beneficiary household. Responsibilities. 1. Participate in every activity required by the program, including receipt of payment. 2. Diligently undertake their co-responsibilities. 3. Cooperate with case management processes. J. Other partner institutions. These institutions support LEAP program implementation, especially on issues relating to LEAP households' co-responsibilities and linkages. They include 1. Office of the Head of Local Government Service. 2. Ministry of Health. 3. Ministry of Education. 4. NHIA. LEAP case management processes and procedures. A. The LEAP program has a grievance redress mechanism that receives and manages the resolution of complaints, claims, and beneficiary information update request. B. Systems and processes are in place for the household through the community, district, regional to national levels. For example, at the community level, CFP or CLIC members receive or facilitate the reporting of cases or update requests to DSWOs. Also, the Ministry of Gender, Children and Social Protection has 2 toll-free telephone numbers for the public to lodge complaints, cases, grievances, known as the Single Window Citizen Engagement Services. The numbers are 0800 800 800 or 0800 900 900. You can also contact the LEAP program on 0303 969 700 or 0303 969 399. C. Processes for LEAP case management. Receiving case from petitioner. Registering of a case or update request. Resolution of the case. This includes case or update request assessment, preliminary inquiry, investigation, and determination of outcome. D. Communication of outcome to the petitioner. E. Case review or appeal. F. Follow up. G. Monitoring and evaluation of case outcomes. H. Tools for case management data collection. These are case form, case record log sheet, beneficiary information update form, updates record log sheet. Investigation summary form. Appeal or review form. Caregiver change form. Death notification form. I. Channels for reporting cases. These are by post, by email, hand delivery, referrals, in person, phone calls, field work, that is, investigation and monitoring. J. Outcomes of LEAP case management. These include case resolution, change in co-responsibility monitoring and sensitization, LEAP grant review, changes to demographic characteristics, exit from LEAP, program operational and policy reforms. Beneficiary Charter of Rights and Responsibilities. A. This publication of the LEAP program seeks to recognize and assert rights and responsibilities of LEAP beneficiaries. B. This is necessary because the rights of beneficiaries must not be taken for granted or violated in the course of service delivery. It is important that all beneficiaries exercise their rights and responsibilities as outlined in the program guidelines. C. The LEAP program has a duty to create the enabling environment for beneficiary household members to enjoy or assert their rights as citizens of Ghana and members of their communities. For the details, refer to the LEAP booklet, Beneficiary Charter of Rights and Responsibilities. Enhancing linkages for LEAP beneficiary household members. A. The assumption underpinning linkages is that cash grant to households is necessary but not sufficient to help very poor and vulnerable households to move out from poverty quickly. B. Linkages are enabled or constrained by supply and demand side issues as well as coordination. C. LEAP households need to be linked to social and other complementary services and opportunities. The referral processes will require needs assessment or self-selection. D. Linkages has the potential to enhance human capital development, ensure targeted service delivery to LEAP households, enhance coordination of social protection programs, and to accelerate processes for the graduation of LEAP beneficiaries from poverty. E. Internal processes for complementary services that will benefit LEAP beneficiary households include the following steps: identifying priority services, signing an agreement, implementation, monitoring. LEAP Programme safeguards. A. The LEAP Programme is sensitive to the needs of men, women, boys, and girls. B. Gender issues are being considered in the program design and implementation. How is the performance of the LEAP program assessed? A. The program is assessed internally and externally. B. Internally, the program is assessed through the program inbuilt M&E mechanisms as well as the MOGCSP M&E mechanisms. C. The program is assessed externally by third-party institutions periodically and on ad hoc basis. For example, impact evaluations, that is baseline, midline, and endline, independent monitoring checks, etc., conducted by academia, civil society organizations, and development partners. LEAP communication. The LEAP communication strategy seeks to promote communication with key program stakeholders in a systematic and effective manner through the application of various tools and channels. One of the key objectives of the LEAP program is to continuously maintain an open communication channel between implementers and the program participants. The LMS uses various IEC and audio-visual materials and channels to reach out to stakeholders. The following are the main channels and tools for LEAP communication. Community Information Centers, IEC materials, face-to-face meetings, that is, beneficiary fora and home visits, gong beating, courtesy calls, community radio, airing of jingles and documentaries, mosque, church, letters, wireless messages, print and electronic media, social media, website, dialogues, meetings, derbers, and exhibition. LEAP Management Information System, MIS. A. The LEAP program utilizes an MIS application to register targeted households and evaluate household information to identify beneficiaries. The LEAP MIS is a centralized repository and database used in the management of the program. The MIS applications perform the functions within the scope of the program. The application is segregated into modules administered by the various units of the LMS. The MIS process involves data capturing, validation, and scoring of potential beneficiaries. Selection of beneficiaries. Enrollment of beneficiaries. Processing of payments for beneficiaries. Monitoring and evaluation. Reconciliation of payments. Case management. Contact. You can get further information about the program. A. By contacting your CLIC member or community focal person. B. By contacting your district social welfare officer or a DLIC member. C. Visiting our website at www.leap.gov.gh or via our Facebook page, LEAP Programme Ghana. D. From our leaflets and fact sheets available from your district social welfare offices and also from the LEAP Programme office in Accra. E. By calling the LEAP Programme on 0303 969 700 or 0303 969 399 or our contact center on toll-free number 0800 800 800 or 0800 900 900. F. By writing to us at the LEAP Programme, P.O. Box MB 471 Ministries, Accra. G. By emailing us at info@leap.gov.gh or leapprog@leap.gov.gh. By following us on Twitter at leap_program_Ghana. This material was developed by the Ministry of Gender, Children and Social Protection (LMS) and its partners. Government of Ghana, LEAP Programme, UNICEF, UK Aid, World Bank.